I think we'll get started, if that's all right. Okay. My name is Sally Mank. I'm a Medicare counselor at JABA, and I have worked with UVA retirees for many years, explaining how the two systems merge. And with me is my supervisor, Randy Rogers, who is the head of all of the programs like Medicare counseling at JABA. What we're going to talk about today is how Medicare relates to you as you approach retirement. For most of you, for all of you really, once you're retired, Medicare will become the primary health insurance. Other health insurance that you have through retirement will be secondary to Medicare. So Medicare, you're eligible for Medicare at age 65, or after you've been receiving Social Security disability benefits for 24 months. Medicare is not available to people who retire before 65 and not available to spouses under 65 if the retiree is over 65. So that's a place where you have to walk carefully through these, age gradations with the Human Resources Department to figure out where you and your spouse fit in. Each spouse needs to enroll in Medicare. There are no couples plans in Medicare. Everybody gets their own Medicare account and Medicare number. And for those who may have just come in, the handout package is on the back table. I think I need to go back one slide. Medicare for state retirees. We've covered that. And as the previous speaker said, for those of you who were here for the VRS presentation, if you have at least 15 years of state employment, you will probably receive a health credit to offset part of your out-of-pocket expense for health insurance. So whether you get your health insurance through the state retirement system or outside of it, you will get that credit, which is $4 for every year of service if you've worked 15 years or more for the state. So that's a nice way to offset some of your expense as you're thinking about your budget. Okay, what is Medicare? Medicare Part A is hospital insurance. We all pay into that account. That's part of FICA on our withholding taxes. And so everybody pays into Part A through their work, or they get it through the spouse's work if that person hasn't worked enough quarters. Medicare and Part A pays for being in the hospital, the use of the hospital facilities and so forth, not the treatment you get, not the surgery or the x-rays or the scans.
I'm going to jump one slide ahead. That's the slide. That's
okay, sorry.
It's okay.
Excuse me. Medicare pays for the hospital and also pays for skilled nursing care. So if you need rehabilitation after surgery or heart attack or something, and need to go to a rehab facility like Health South or the Transition Hospital or a nursing home like the Laurels, Medicare will pay for your stay in skilled nursing and for the treatment you get there. Medicare Part B is the workhorse of Medicare. And for that, there's a monthly premium, which is currently $134 for that. And Medicare Part B pays for all of your medical professional services, but surgery, visits to your doctor, PT appointments, anything that scans and anything that is a medical service that you get from a Medicare provider. Now, moving on to the next slide, Medicare includes now something called Medicare Part D, which is prescription coverage, and this has been in effect for about 13 years. And we'll talk about prescription coverage with Medicare in relation to the prescription coverage that you can get from the state plan. Now, for most people, there's a need to supplement Medicare because Medicare A and B have some significant deductibles. So for folks who do not have access to a retirement program like the VRS retirement program, those people like me have to buy their health and their supplemental insurance that pays their co-payments and deductibles on the private market. And that's what's referred to as Medigap. And you may have family members who have Medigap policies through Mutual of Omaha or AARP, Anthem, USAA. And they may be telling you that it's wonderful. But you also want to compare the benefits of the Advantage 65, which is the state plan. We'll talk about that in a minute. Now, Medicare Advantage is not the same thing as Advantage 65. And here we have that on our slide here. Medicare Advantage is a different package of Medicare benefits. It's the same benefits, but a different way of packaging them. And it's, you get your health insurance coverage through a company like Humana, or Aetna has one that's a HMO with the University of Virginia. And so it's another approach. They call it an all-in-one plan because all your Part A, your Part B, and your prescription coverage are all included within that package. Okay, let's talk now about where you fit on the continuum. And how you get into Medicare. If you're retiring at age 65, are you already receiving Social Security income benefits? And if you are, then Social Security, which is the entry point for Medicare, will send you your Medicare card about 3 months before your 65th birthday month. And the card will show that you have A and B and the effective date, which will be the first day of the month of your birthday. If you're retiring at 65 but not receiving Social Security income yet, then you can enroll in Medicare and Social Security. Well, let's leave Social Security out, but you can enroll in Medicare and wait till later to draw your Social Security. You can enroll in Medicare in a 7-month period that begins 3 months before your birthday month and ends 3 months after, at the end of the 3rd month after your birthday month. So if your birthday is in April, the enrollment period when you could enroll online in Medicare starts January 1st and ends August 31st, I think. Anyway, no, July 31st. July. I should have calculated that one out before I threw it out there. So you can defer Social Security income benefits as long as possible, up to age 70 and a half, to get a bigger benefit. But if you want to start your Medicare, then you can do it that way. And the current premium for Part B is $134, and you will be billed, if you're not drawing Social Security income benefits, you'll be billed quarterly for your Part B premium. So that's a little over $400 that you'd be billed. And this one doesn't quite fit, sorry.
Well, this is if you're retiring after 65.
This should be after 65.
Yeah, it should be retiring after 65.
Okay, let's instead of saying retiring at 65, retiring after 65. So if you have worked to age 67, say, you'll need to do your Medicare enrollment in person at the Social Security office. It's up on Pantops for those of you who live in this geographic area, and there's also one in Lynchburg and one in Culpeper. But what you would need to do is get a form filled out by the HR department here at UVA that certifies that you had health insurance past the month of your 65th birthday. So if you worked 2 more years, you would need to get that form filled out that said you had what's called creditable coverage. That means that it's as good as Medicare. It's a comprehensive health insurance package. And the Human Resources Department would fill out that form, their part of it, you'd fill out your part and take it to Social Security. But if you're more than 65, and that's when you want to start your Medicare. You do have to do it in person. You have to have that paper form filled out that says you had creditable coverage.
Yeah, Sally, it's one of these things where people get kind of confused with thinking, oh, Medicare sort of automatically happens. But in most of these scenarios, you're going to have to actively go to Social Security to get your Medicare activated. So
Right.
that's sort of one of those things where in the public knowledge that people kind of think about it wrong and then get caught where they didn't get their Medicare started. So in a lot of cases, you do have to actively get your Medicare started with Social Security.
Okay, if you're retiring before age 65, then you really need to work with Human Resources about coverage for both you and if you're married, your spouse. And in general, what happens is here at UVA, the employee coverage continues until you reach 65 and until your spouse reaches 65. So the package that you get for an active employee continues to be your health insurance until you turn 65. When you turn 65, then the Medicare primary coverage is available to you.
Right. And if I can jump in one more time, one that we've been taught from here, from HR here is, if for some reason you don't continue like you've retired at 63 and you don't continue the UVA insurance to 65, you have limited your options when you turn 65 of what can be offered to you through the state and through Advantage 65. So you want to be very careful about going elsewhere for your insurance between the time you retire and 65. You want to talk that over very clearly with HR to realize what that will have an impact on you when you get 65.
Yes.
Quick question?
So supposing you retire at 62 and you stay in the UVA plan,
Yep.
are you now paying your share of the monthly premium and the UVA share? So, but
Yeah.
you're
Yes.
still on the plan, you're just...
Yes.
I think so.
And again, we're not the
Yeah.
experts on that,
Yeah.
but what we know, you would have to talk to them directly, but they're shaking their head yes.
And the retiring rate's equal to what, for active employees?
The retiree rate is
It's higher.
No, that's to say active employees plus the UVA coverage.
it's different. And they're published on the website. It's the same coverage, but retiree health insurance coverage is more expensive than
Right.
individual, and it's not the same, it's not just the employee contribution and the employer contribution, it's an actual retiree rate.
Okay.
Yeah, it's different. So, but that a scenario where this might play is the UVA employee is retiring at, let's just say they're retiring at 66, but their spouse has been on the plan and that spouse, him or her, is 63. You still now want to consider retiree UVA insurance. You guys shake your head yes or no. For the spouse until that spouse turns 65. Because, again, without doing that, it will limit what is available to that spouse and retiree when they get to 65. So it's just, we just want to give you guys enough scare warning to make sure you talk this over carefully with them when you do this.
Okay, here's the one about retiring after 65. We've already covered part of that. But it's important, as Randy just said, not to get Part B when you reach 65 if you are not retiring. You can go to Social Security or use the website to enroll in Part A when you turn 65. There may be a little bit of benefit to you possibly for hospital or skilled nursing needs, which are for Medicare Part A. It would be secondary to your state coverage, and I think it's unlikely that you'd need the benefit. But you could go ahead and get Part A. You can enroll online in that at the Social Security website. But do not get B, because that will, first of all, mean you'll be paying a premium for a benefit that you're not using, and there are very significant coordination of benefits complications and issues that arise if a person has Medicare Part B and also has an active employer plan. So even if you're 65 and you want to get your A, go ahead and do that, but don't get B. And if for some reason, like if you're if you or your spouse is drawing Social Security benefits and you get a Medicare card that is related to your birthday and says you have A and B, you don't want to keep that card. You want to send it back. There's a Medicare card comes in a little tear-out sheet of cardstock, and if you don't want it, if it says A and B and you only want A, you turn it over, sign the back, say I decline B, and send that whole mailing back to Social Security. You don't want to get B until you are ready to make that your primary health insurance. Okay, here we go. We're retiring after 65. Let's use our example of somebody who's 67. 3 months before your retirement date, contact Social Security to enroll in Medicare Part B, and that's where you need to get the form from HR. And then you talk about your health insurance choices with HR. Okay, so we've gone through the process of signing up. Now let's talk about, well, what is Medicare? How do you use it? And how does it relate to other insurance? Medicare Part A all of Medicare has some gaps. It was intended for the beneficiaries to pay part of their costs. And of course, what the costs were in 1965 were insignificant compared to what they are now in terms of percentages and things like that. But currently, Medicare Part A has a deductible of $1,340 per benefit period. And you can have more than one benefit period in a year. This is not an annual deductible. If you go in the hospital twice, you'd be responsible for that deductible each time. Now, there is insurance to cover that, and your Advantage 65 plan with the state will cover all but $100 of that Part A deductible. So that's an insignificant out-of-pocket contribution if you're having a $40,000 hospital stay. Other gaps in Medicare Part A include hospital co-payments that start after after 61 days in the hospital. And again, your supplemental insurance, including the Advantage 65 plan, will cover that. Yeah.
I was just looking at this yesterday. I think it's about $300 a day after 60 days.
I believe it is. Yeah, it's
35 or something.
right. Yeah, thank you. You're well ahead of the game here if you've been checking on that.
But if
Oh,
But if you
good.
have Advantage 65 or another supplement, that number is zero.
Right, but we have lots of problems with the Advantage plan.
Well,
Now remember, let's go back and
okay.
just remember that Advantage 65 is the state retiree supplement plan to Medicare. It's not a Medicare Advantage plan.
Yeah.
And in fact, I believe Sally's informed me that the Advantage 65 was named that long before Medicare Advantage plans came around, and the state was like, hey, we had the name first.
But they couldn't think about it, I guess. Does everybody understand that? Advantage 65 is really a Medigap policy. It's secondary to Medicare, it's insurance. Medicare Advantage plans like Humana or the Aetna UVA plan are HMOs or PPOs. They're managed care plans where you pay co-payments for pretty much every service, but you have a lower monthly premium. And a key difference in the two is that Medicare Advantage usually requires you to either see network providers or makes the co-payments more attractive if you see network providers. That's a form called PPO, Preferred Provider Organization. You want to stay away from those to the extent you possibly can, but your Advantage 65 plan with the state works just like Medigap, the same as it was AARP or a USAA Medigap policy.
And when she says stay away from them, the state numbers are people who are 65 and older who are on Medicare. 2% of them are on Medicare Advantage plans, the PPO, the HMO. Everybody else is on Medigap supplement plans, either through the private market or like Advantage 65 that you guys would be offered.
Yeah. One little aside, though, is that Medicare Advantage, the PPO, HMO kind of thing we've been talking about, is the only kind of Medicare available to a person, the only way to supplement Medicare for a person with a disability who is under 65. So you may know people or may have worked with people who are disabled. They will have to get their Medicare supplement insurance through a Medicare Advantage company. That's true in Virginia. It's not true everywhere, but we don't have any plans for people, disabled people. So other gaps in Medicare, Medicare Part B, the medical services part, has an annual deductible of $183. Now that doesn't sound very bad, and insurance will cover that for most cases. Advantage 65 does not cover that 183. So that 183 is your one out-of-pocket cost for Medicare approved services. But it's
And again,
it's a
that's
small
for the
cost.
year, not per incident.
That's right. Yeah.
Can I say one more, because I've figured this up on behalf of a lot of my patients.
Uh-huh.
So if you have some other supplement plan, there are a lot of Medicare supplement plans. Some of them cover this $183 and others don't.
That's right.
Yeah.
But if you add the difference between how much these plans cost, it's usually like $50 more a month to cover the $183.
Right.
So you're paying $600 in premiums over the year to save yourself $183.
Right.
So you're losing $430 every year when you have this plan. So be glad when you get a bill for $183. You've got the best plan.
That's a good explanation and a good endorsement. And that 183 is the first medical spending that under Part B that you have in the course of a year. So 183 doesn't sound very bad, but look at the next number, 20% co-payments. That can get to be a huge number if you have significant treatment, a hospital stay with a surgery or something. So those are the reasons why some kind of supplement, including the Advantage 65, are really important benefits to secure.
Right. And the scary part about that, if like my work insurance, I may have a copay of 20%, but I got an out-of-pocket maximum of some ridiculous $10,000 or whatever. Medicare has no out-of-pocket maximum on its own. So 20% of infinity. You go in for $100,000, it's $20,000 on you. Go in for $1 million, it's $200,000 on you. But when you have your Advantage 65 or another Medigap or supplement policy, now that's covering the 20%. It's taking care of the 20%.
Okay. And
Go back to what you said earlier,
Yeah.
that you retire before 65 and don't take the VA health insurance, that you're restricted on the Advantage 65?
On the Advantage 65, there may be restrictions on what the state. Now, it's not a restriction on you going and getting a private supplement policy or Medigap policy, a Plan G, a Plan F, a Plan N, any of those. There's no restriction on that. But it has to do with what is offered through VRS as for the Advantage 65. And again, I'm not the expert on that. You'll need to talk with them. But I can say that in what I've seen is there is limitations. You may not be offered it. And they're shaking their head. Is that correct? You will not be. You will not be offered. I can now say that with definitive. You will not be offered that if you decide at age 63 you're retired and you say, I'm going to go get a marketplace account, or I'm just going to go get a policy through this company or that company. I'm not going to bother with UVA. You forfeit your right to have the Advantage 65 supplement plan, which not only includes the supplement, but also includes dental and vision, which most supplements don't provide.
And just to, yeah, go ahead.
If you have the years, like I have 20 years, but I don't have the age, but I'm looking for a career change that might take me out of UVA. So I was looking to retire at 20 years and then work somewhere else and have a second retirement. So I would have to pay.
I think you need to talk to HR. This is outside of our area.
To keep the option of the Advantage 65.
Yeah, there's a calculator in your head going, how, at 63, is it worth it for me to stay in? At 60, is it worth me paying it 5 years? Or at 55, is it worth it? There's a line in the sand where you cross where it's not worth it.
Just to mention a couple more gaps in Medicare. Medicare pays in full for up to 20 days of rehab kind of skilled nursing, but after that you have a copay of $167.50 for a total of 100 days. And that's an expense that if people don't have coverage for it, they really can feel very put upon by that. And the first 3 pints of blood, I think, now are covered by Medicare. But just to give you some idea of where you would have expenses if all you had was Medicare A and B. Okay, so how do we fill those gaps? Medigap insurance and Part D plans are the route that people who are do not have your good Advantage 65 plan available to them choose. Medicare Advantage plans, which we've talked about quite a bit, and VRS Advantage 65. The VRS Advantage 65 is pretty much equivalent to what's called Medigap Plan G, if any of you have looked into the Medigap plans. It's almost identical. And other sources of retirement health insurance might be TRICARE for Life, which is available to people who have military retirement and their spouses, and the Federal Employee Health Benefit Plan. Those are the significant outside plans, and they're pretty comparable to Advantage 65. If you were not eligible for Advantage 65, you could look into getting Medigap insurance. If you did that, you'd purchase it from an insurance company, and we have a listing of those companies, but we don't help you make that purchase. We give you the information on how to contact them. It pays the Part A and Part B deductibles and co-payments. It does not have dental or vision coverage except as an add-on. And what we find, and this is a talking point for your Advantage 65, the benefit is pretty limited. It's basically, for most plans that are under $50 a month premium, all you're getting is your standard twice-a-year dental hygiene appointment and 1 set of x-rays. Well, if you're paying $50 a month insurance for that package, that's $600 for the year. That's more than your dental benefit that you're buying. So everybody's coming in these days saying, who's shopping for Medigap insurance and talking to us about it, and I want dental and vision. And we tell them it really is not cost effective.
What we tell them is they should have worked for UVA.
Well, but those of you who have access to Advantage 65 have access to a reasonably good dental and vision plan. Now, to clarify about the vision coverage, Medicare doesn't cover a standard refraction, an exam to see if you need new lenses, and it doesn't cover the cost of eyeglasses. But if you have a medical condition of the eye like cataracts or glaucoma or an injury or a retinal tear or something like that, Medicare considers that to be an illness, a medical condition, so it does cover it. So don't be alarmed if you've got glaucoma and you see that Medicare doesn't have vision benefits. It will treat your glaucoma the same way as it would treat your knee surgery. And the premiums average about $130 a month for Medigap insurance, so you kind of factor that against the somewhat higher premium but better benefits of Advantage 65. And there are no out-of-pocket costs for Medicare if you choose Medigap Plan F. And this is going to be a little bit of inside baseball for you who are going to go to Advantage 65 and don't need to know anything about Medigap. But starting next year, well, 2020, no new Plan F, which is the most comprehensive plan, no new Plan Fs can be sold anywhere in the country to new enrollees. So people like me who have an F plan, we're probably going to see our premiums increase over the years more rapidly. They have increased already, but they're going to increase more rapidly because there won't be any new enrollees coming into the system. So we're recommending that people get a Plan G, which covers all but the 183 Part B deductible. But that's probably not a detail that you need to remember. Now the Medicare Advantage plans, we've kind of covered those, but just to go down the list here to be sure we haven't missed anything. They do have lower monthly premiums than Medigap. They require a co-payment for all services, or most all services. They do, as Randy mentioned, have an annual cap on out-of-pocket expenses, so that if a person with one of these plans had a huge lot of medical bills in a year, they would stop paying co-payments when they hit $6,700. A real big disadvantage in Medicare Advantage plans, excuse me, is that providers can refuse to accept PPO plans, and they may not be in the network for the HMO plans. So people who choose these plans may have to switch providers, or they may find that their choices of providers in the community are quite limited, particularly, I mean, this is a resource-rich community for medical services, but there are still some services that are not covered by these Advantage plans because they haven't recruited doctors, highly trained specialists into their networks. And the plan is on contract to Medicare to provide all your services. You cannot submit claims directly to Medicare if your provider is out of network or doesn't accept the plan. So you'd have to just accept the full payment responsibility from a provider who's out of the network. And one of the real deficiencies in the provider networks is in the area of mental health. Very few mental health providers are in the network, are in the Advantage plans. So that's a real downside to them.
And UVA is out of network with some of these plans. So you sign up for it and you go to UVA and you're not covered.
Right.
You don't discover that until you're in the hospital.
That was a major issue 3 years ago, but 3 years ago, Humana and UVA, for the most part, for most of the UVA providers, finally shook hands and agreed to see each other. So now the plans, UVA is in network for most plans.
For most plans.
No, I'm saying is for most providers in UVA.
Is it for the United Healthcare plan? Are they in
No. For all the plans that are offered right now, the Humana plans and the Aetna plans, UVA is in network. Now, whether a specific doctor in UVA is in network for that plan, that may get a little squishy. But for the most part, because 3 years ago, if you had any Advantage plan, you couldn't go to a UVA facility and be covered. But that changed 3 years ago.
Okay, let's talk about Advantage 65. The monthly premiums, and I think that should say 2018, but the HR ladies can correct me on that. Right. So they have a range of premiums. The Advantage 65 plan pays all your Medicare deductibles and co-pays with those two minor exceptions we've talked about, the $183 Part B deductible and $100 of the $1,340, it should be Part A hospital coverage. It does offer dental and vision coverage, and it offers prescription coverage.
So the Advantage 65, is that in addition to you paying a premium for the Advantage 65 and the Medicare?
Yes, you pay 130, pardon?
So the Advantage 65 is like a supplementary insurance?
It's exactly what it is. And you don't have to take it, but it's got some real good benefits to it. And of course, if you, once you decline it, you can't get into it, or decline a portion of it, like the prescription benefits. So it's important to, really weigh through the budget consequences of those premiums as you look at this. One thing to know that's in favor of Advantage 65 is that the premiums do not increase with your age. They increase with costs increase with the cost of health care. So you do see premium increases, but they're not the same increases that a Medigap plan imposes on people based on age. I started out in my Medigap plan F 11 years ago at $95 a month, my premium, and my premium is now $220. It's pretty close to the top because I've talked to people over 80 who were paying $250. So that's kind of the range to look at, and that's if you have family members who have Medigap.
And in comparison, so that's what a outside of UVA retiree, you go get one of those. That's the kind of curve you're looking at.
Right.
Now, in the 3 years that I've been, in this position, I've watched the Advantage 65 has stayed fairly straight level. So, if not, it actually decreased a little bit in cost. So that's what we're saying. The difference between an Advantage 65 is that the cost is going to be on cost of the, not of your age, but of what the health cost is for the group. But if you get a outside one, you get a G plan or so, it's based on your age and it's one of those guarantees we tell people, taxes, death, it will increase every year. So.
And the Advantage 65 plans, you pay the same, everybody in the plan is paying the same premium, whether they're 90 or 65. So that holds down your premium increases as you age. Okay, drug plan choices. Here's where we have some alternatives to what the Advantage 65 program offers. You have two choices, and one is I believe is it still called Medco Enhanced? Express Scripts, okay. The Express Scripts plan is very good coverage. It's probably the best. We've worked through the numbers for people who have a lot of high-priced brand name drugs, but you may be able to get better, a lot lower cost if you take relatively few prescription drugs or even none at the current time, to getting a Medicare Part D plan. Medicare, you're looking at premiums of, the difference between the premium in Advantage 65 for the health plus dental and vision and the health plus dental and vision plus the drug coverage is about $125 a month.
128, I believe.
The Medicare Part D premiums average around $30 a month. So you could be saving almost $100 a month by foregoing the drug coverage in Advantage 65 and getting a Medicare Part D plan. The downside to it is that it's really important that people keep up with their D plans and review them every year, because the plans can change their coverage and they can change their premiums. And a lot of plans last year had significant premium increases. And what we do at JABA is that by appointment we see people with Part D plans, compare their plans, the new plans that have the data just came out last week on what the new costs are, and we're starting open enrollment next week. And if you don't go through that exercise, you could wind up having unnecessary out-of-pocket costs for your premiums. So that if you get the state plan, you can just get it and forget it. Just pay your premium. If you choose to go the lower cost route because you have limited number of drugs and you mostly take generics, and you get a Medicare Part D plan, you should plan for the rest of your life to review that plan every year. Now, lots of people do it online, particularly if you yourself is pretty computer savvy, or if you've got family members who can do it for you. You don't have to, go over to JABA and get your plan reviewed every year. But that is the one caution about choosing to get a Medicare Part D plan for your drug coverage, rather than getting Advantage 65's drug coverage.
Right, and let me just do the side thing give you a little bit of data on that. So national average is people who have D plans, that 87% of them are on the wrong plan for them because they forgot to check them. Now, we've got people who come back year after year and we check them, and so it stabilizes out a little better, so we make sure. Last year, our counselors saw 1,871 clients in 7 weeks. 52% of them were like, you are fine, stay on the plan you are, do nothing. The other 48% were, oh, there's going to be a problem, one of your drugs fell off the formulary, the price of this premium shot through the roof, all kinds of different issues that could have come up. So those 48% of people, we were able to switch plans just by clicking the button, okay, this is the best plan for you next year. And we just said, well, this is what you would have been paying versus this is what you're going to be paying now that we've changed you. And we added up all those numbers to a tune of $1.28 million we saved people in Charlottesville on their drug costs for next year. So if you go that route, it's going to be much cheaper in the long run to go on a D plan, but you've got to come and either with us or do it yourself, check out it every year and make sure it's the right one for you. This is a free service that JABA offers. It's a federally funded program to make sure you have boots on the ground to help you with this. So we're there to help you all the time. And so before I let Sally go back, it's always advisable is 3 months before you're going to start Medicare or you turn 65 or you retire, you come see us and we'll help walk through, here's the things that need to be done to move forward to make sure you're in the right place when you're done. That you guys send us people all the time. And we're here to help. That's what we're doing. Okay, back to the regularly scheduled program.
I just want to say, the job of building is a beautiful building, so
Oh.
beautiful flowers.
Yeah, right, thank you. Okay, so we don't actually have access to a way to compare drug plans. We ask clients who are thinking about the Advantage 65 and keeping the drug coverage to do that research for themselves. We can do the research on the alternative Medicare Part D plans.
Quick question, please.
Yeah.
When I retire, can I enroll my spouse in Advantage 65?
If your spouse is over 65 and already on Medicare and you're the UVA employee, yes. I can answer for them, yes.
Right.
If they're not 65, but they're on it because of disability.
Same answer. If they're eligible for Medicare, then they are eligible for PRS.
Because,
Okay.
and that's the exception in the state of Virginia, is if you are not in this Advantage 65 possibility, you do not have, you technically can, but in reality cannot get a Medigap policy before you turn 65. But you can, given this circumstance, get Advantage 65, which by all means take that.
Right. Just briefly, I'm going to talk about a couple of things which we don't have a lot of material about, but there's something called extra help, which is for people with limited incomes, and we don't have the income numbers here with us, but they're up to 150% of the poverty level. So a person with a limited income may be eligible for extra help with a state drug plan or with a standard Part D plan. And that information is available, I think, on our website, isn't it?
No, on the website, and it's obviously, we can help with the application.
Right, right. And it's a pretty simple application. Income tax deductions, I think that slide is out of date, so we're going to skip it. Here's some numbers about income levels at which people qualify for Medicaid. And there may be some state UVA retirees from some of the lower paid occupations who might be eligible for, if not full Medicaid, what are called Medicare savings programs. And the Medicare savings programs are a limited form of Medicaid, but they have a very useful benefit. First of all, they usually get people lower co-pays on their prescription drugs, and they pay the state Part B premium. So that $134 a month that no longer gets taken out of your Social Security can be a real significant lifestyle improvement for people. UVA financial.
I was going to put an add-on to the Medicaid.
Okay.
To the Medicaid, just because it's in the news and everything. You know, Medicaid expansion, Virginia is coming into effect here very soon. They talk about 400,000 more people going on to Medicaid. Realize that that does not affect a single person over 65, the way all those rules are set up. So nobody over 65 is getting in on the expansion of Medicaid. They're either were eligible for Medicaid before they weren't. So it all has to do with people who are under 65.
And these numbers here and this information has to do with the people 65 and older, or who have Medicare, who have disability.
Right, but if somebody is on if somebody has disability and under 65, then Medicaid expansion could affect them even if they're on Medicare.
Possibly, yeah.
Yes.
Okay. And financial assistance is available to UVA patients with a sliding scale for healthcare and prescription costs. And that usually works in tandem with other types of medical and drug assistance. Now, Medicare has some preventive care benefits. They have a Welcome to Medicare physical exam, and then for any problems that are identified in that physical exam or that come along later, there is also an annual wellness exam. So it's not called a Medicare physical, it's called a Welcome to Medicare exam and a wellness exam, but it's essentially the same thing as a physical. And that's a relatively new benefit. They did not cover those, Medicare did not cover physicals at one time. Medicare covers a number of preventive care services like mammograms, colonoscopies, other cancer screening tests, and other with no copayment. And some other preventive tests are available if you're at high risk for things like diabetes or aortic aneurysms or a few other things like that. And Medicare.gov, or MyMedicare.gov is a secure personal account to track your Medicare claims, and they will send you notices like it's time for your colonoscopy, based on when you had one last. And we have Medicare services, Medicare counseling services at JABA. And then Department of Human Resource Management for the state has information on their website. Now, I'm going to talk very briefly about Medicare fraud and abuse. And as a starter for that, if you look in your folders, there's a one-page sheet that came from Medicare about the new Medicare cards. And if you have Medicare or your family member has Medicare, they should have received a new Medicare card by now. They were all mailed in Virginia fairly early in the rollout of this, and so by June, every Medicare beneficiary should have received their new card. The thing about the new card is it has a rather bizarre ID number that consists of capital letters and numbers in this strange mix that's going to be impossible to ever to memorize if you're 65 and older. But the whole idea was that the Medicare number was the Social Security number with a letter after it. And that made it very, very susceptible to identity theft. So, because Medicare cards are out there in the community quite a bit. They're being shown at doctor's offices, people carry them in their wallets, and it's the same number. So it just amplified the opportunities for identity theft. Now, if somebody who already has Medicare has not received their card yet, it's probably because they moved and Medicare didn't get their updated address. So if you know anyone who doesn't have the card yet, the thing to do is call Medicare, and it's probably an address update kind of issue.
Because anybody in the state of Virginia on Medicare already should have had their new card by the end of June. So if they don't have their new card, there's a problem. Now, that old card still works for another year.
That's right. The old cards are good through December of 2019. Very briefly talking about Medicare fraud, we're all vulnerable and susceptible to that. Things that the consequences are that Medicare money gets paid to improper claims filed by people who are trying to game the system. Not so much people, individuals, patients, but providers or bogus providers. The Medicare Trust Fund is at risk for drawdown from overpayment for illegal or improper claims. As Medicare beneficiaries, this will affect the funds available to us. It could result in higher premiums, like for Medicare Part B, and less money for needed benefits, and possibly quality of treatment. Medicare fraud is intentionally billing Medicare for services that were not received, or billing for a service at a higher rate than is actually justified. Medicare Abuse is that providers provide services or products that are not medically necessary or do not meet professional standards. An example of something like this that goes on is people being solicited to buy things like back braces that through either internet or TV ads or mailings and things like that, and they send in their money, and what they get is first of all, either they get nothing or they get something that is so woefully inadequate that it doesn't even cover the supposedly discounted payment that they made for it. The most examples of fraud that we see and abuse have to do with kind of mom and pop nursing homes. There seem to be, every year there had one or two pop up, mostly in the Shenandoah Valley, where the agency submits bills to Medicare saying that skilled nursing services were provided to a homebound patient, and that means the services of an RN or an LPN or a physical therapist, and really it was just a CNA who was out there to give the patient a bath, but they billed with the wrong code at a much higher rate, because they can't bill Medicare for CNA type services. So that's the main example that we see around here of Medicare fraud and abuse, but it never hurts to be on the lookout for it. And what we suggest in the handouts that we've given you, there's a personal health care journal to keep track of your medical appointments, so that when your Medicare notice comes and you see something that doesn't sound like you really went to the doctor on that day, even if it's your regular provider, take a look and see if you've got a record of that, either in a calendar like this or your personal calendar. And in the folder that we've given you is some real helpful information about how to read your Medicare summary notice. And I've been working with this for 20 years, but I still go back to this chart to explain to clients how the Medicare notice is set up, what the different little categories mean. So generally speaking, most people, who have felt they were mystified by the Medicare notices and what they really mean, when they read through this, they get it. So I recommend that. So it's recommended that you treat your Medicare card like a credit card and Medicare number. Just hang on to it keep it carefully secure in your wallet or wherever. Don't carry your card unless you will need it. Of course, we never know. But also be aware, be particularly attentive, not only for yourself, but for an older family member, for telephone solicitations, for either trying to sell you products or telling you that a product has been ordered for you by your doctor and you need to pay the shipping on it. Medicare is never going to contact anyone by phone if they have not contacted Medicare the other way first. So anything that says that we're representing Medicare, we're representing the government, we're representing Social Security, and it's not a call that it's a response to something you've initiated, is something to hang up on. And that's one of the major kind of places where elderly, lonely, perhaps somewhat cognitively impaired folks fall into those kinds of traps of telephone solicitation. So please be very, please advise family members about watching out for that kind of thing, and tell your siblings and cousins about it too, so that they can help protect the vulnerable elderly. If you do find a situation that you think is fraud, either on behalf of yourself or a family member, you can call the toll-free number on the front of this folder, and they have representatives who take cases and will get in contact with the proper authorities. If it's a federal issue having to do with Medicare, it goes to the U.S. Department of Justice. If it's a state issue like related to Medicaid, it would go to the Office of the Attorney General. But they have report forms to fill out and submit this information. They take it seriously. Also on your handout are numbers that you might need to call. The quality of care complaints go to a regional organization called KeyPro. Long-term care ombudsman is a very important state agency. We have a long-term care ombudsman at JABA who is a paid staff member who investigates claims of abuse in nursing homes and helps negotiate and work out problems in the nursing home or the home care industry. Medicare appeals and questions, we can help you with those. Suspected Medicare fraud, the numbers that I just mentioned. And JABA's insurance counseling, that's our number. That's right up there, that's our card. And contact us for questions you have about Medicare.
We have a table here too. We're going to be heading right back to that in a second. If you have further questions, things that you need to know, specific for you, we're glad to help you there, and we can also set up appointments for you to sit down with a counselor also. Thank you for being patient with us, and we're just here to help you anytime you do need us. Thanks.
Thank you.